My husband's train set was the first day present. I did this way before I got really, really sick, and when I was sick, there's no way. I basically have what they call atrial fib. My heart would race really fast and be very, very irregular. I would get lightheaded, dizzy, and I would just have to sit and pray to God it was going to pass. I could be in bed, I could be out with my girlfriends. You just never knew when they were going to come. Atrial fib was running my life. I wasn't running it.
A few years ago, I developed atrial fibrillation. I first started to notice that I had an irregular heartbeat. It would come on at night, and then the episodes started happening during the day. Finally, I went into AFib and never came out. I couldn't walk uphill. I couldn't walk more than one flight of stairs without stopping to rest and pant a little bit. I was in my mid-50s at the time, and I thought that that was pretty much the way the rest of my life was going to be.
Madlyn and Rocky both have a condition called atrial fibrillation, which is caused by an abnormal electrical impulse in the heart, and it leads to an irregular heartbeat. Madlyn and Rocky are really examples of the two most prominent ways in which atrial fibrillation presents. On the one hand, Madlyn has the characteristic sort of lightning bolt response where she had her heart rate that just would jump up for no reason. She had no control over it and would go very fast. On the other hand, Rocky had a very different example of atrial fibrillation. It's more insidious. It takes over someone's life. It comes on over years and gradually goes from coming and going to really being there all the time, which means she has an irregular heartbeat all the time. So the treatment of AFib is varied. My field is focused on rhythm control, and that's to reduce the amount of time people spend in atrial fibrillation. The two options for rhythm control are drugs and ablation. The benefits of ablation are that compared to drug therapy alone, ablation has been shown to be more efficacious. Ablation is a way in which we cauterize the areas that are of abnormal electricity in the heart. And we take a catheter, and a catheter is a wire. It's an insulated wire, so we go through the veins of the leg with a small incision that's so small that it doesn't even require a stitch when we're done. That wire goes into the heart, and we use very sophisticated mapping technology, and we use that to then burn the areas where the arrhythmias are coming from. Both Rocky and Madlyn had really uneventful courses in terms of their ablation. Rocky's experience was transformational. She went from being unable to walk up a hill to being able to walk all the time now and outwalk everyone, and she loves that. Madlyn also has had a transformative experience. She's not having these episodes where she feels like she's going to go into atrial fibrillation all of the time. She's been having that for 10 years at least, and now she doesn't have it anymore.
It's a very strange feeling because you're always hesitant, always worried about, is it going to happen? And not having that worry, it's a good feeling.
Within 3 weeks, I was actually hiking uphill. At about 6 weeks, I did a 9-mile hike with 1,900-foot elevation to the top of Montera Mountain, which I had never thought I would see the top of again. Not being in atrial fibrillation, being back in normal sinus rhythm is really liberating. It has really removed the limits that were on my life. I'm not afraid to try things. Before I was afraid to try things. Nothing holds me back now. I'm not afraid now.